Hi, welcome to Visionary Health and this week's Healthcast. This week I took my daughter to the dentist for a filling. Now, the dentist offered me a choice of white composite or silver amalgam fillings. Now, there are opposing viewpoints as to the safety of silver mercury amalgam fillings. What's not disputed is that mercury vapour is given off by them, and this is then absorbed by the body through the lungs and through the mouth tissues. So regardless of whether the body can excrete the mercury again, this poisonous heavy metal, what possible advantage can there be to adding more stress to the body's systems by increasing the mercury burden on the system? And remember, if you're eating some fish, then you may also, and seafood, you might also be increasing your mercury intake that way. So why do we need to help increase the mercury burden by having mercury amalgam fillings as well? I've got this section from a dental textbook. This is from Introduction to Dental Materials by Richard Van Noort, and it makes quite interesting reading. So, mercury toxicity. It cannot be denied that mercury is a highly toxic substance. The most serious potential hazard is from mercury vapour. Dental surgery staff are most at risk from mercury contamination as the material is dealt with on a daily basis. Patients are perceived to be less at risk from mercury inhalation than the dental staff. Certainly there is some ingestion by inhalation of mercury vapour during the placement of a freshly mixed amalgam, but this is believed to be well below the 50 micrograms per cubic metre threshold. Besides mercury vapour inhalation, wear and corrosion will contribute to the overall body burden of mercury. On average, the mercury intake into the body from dental amalgam fillings is believed to be well below the threshold level of 30 micrograms per day recommended by World Health Organization. However, it should be appreciated that this is only an average, and it is possible that some patients can have a mercury level in their body well above average. The thing to note in that piece is the use of the words perceived and believed when the author is talking about patient safety. Personally, I feel that the habitual use of mercury amalgams for any tooth restoration is pretty poor medicine. Hippocrates said, "First do no harm," while adding a toxin to the body is far from my definition of doing no harm. So what's the alternative? Composite fillings are formed from polymers, which form a hard plastic. Fillers are placed in the polymer to lend strength, and that's similar to adding stones into cement to create concrete. The composites are bonded to the tooth cavity, unlike amalgam, which is just stuffed into a hole in the tooth and isn't actually bound to the sides of the remaining enamel of the tooth. And composites can be repaired because you can just bond more composite onto the filling. Whereas if a tooth is damaged more, or the amalgam filling gets damaged or drops out, then all they can do is replace the whole amalgam filling, and that involves increasing the size of the cavity that the amalgam is in. And of course it's more freshly mixed amalgam and more mercury vapour. So the only reason I can see that dentistry still uses amalgam, a mercury silver amalgam, is that it is cheap and sturdy, and beyond that I see no real reason to use it. So remember, the next time you or a member of your family needs to go to the dentist for a filling, make an informed choice. Ask your dentist why they're offering amalgam fillings, and ask them to justify why the amalgam is a better choice than a polymer filling for the job in hand. And if they can give you a decent reasoned argument, and now you have some of the information, then you can make an informed choice. And that's what Visionary Health's here for. Thanks for listening, and I'll see you again soon.